Hello everyone, welcome back to another episode of r/slash Tales from Tech Support. In today's episode, it's happening again, only your device isn't working. Things change after a buyout. Before we get started, make sure to subscribe so you will never miss a video. So let's get started. It's happening again, only your device isn't working. I work as a service engineer in the medical field. I do technical things with medical things. I got a job where the site was having connectivity issues on a system. Occasionally the system would hang, requiring a reboot, which would remedy the issue, or pressing certain keys to refresh the connection. The site advised it was getting worse. Please fix. Basically, it's a PC that connects to some equipment with a data cable in the next room, which is an operating theater. We drop a spare just in case the initial one dies. After that, we're running more cables through conduits in the ceiling or under the floor. I go to site, chuck some theater scrubs on AD, go to the room with the PC, boot the PC, and head into the theater to check the connection to the unit. Other than the original data cable looking a little battered, but okay, they're pretty tough, everything checks out. I bend the cable while testing to make sure there's no intermittent issue. Nope. Run all my checks, etc. all G. I check logs to see if there's some issue. Before these issues, nothing looks weird to me, but I send a copy to the god level techs, and await a reply. Might take a while, maybe they'll see something I don't. I advised the site to use the backup cable, and see if the problem still happens. It's never been used. It's still coiled up from the initial install a few months ago. I coil up the old cable and connect the spare. Fast forward a few weeks and I get a call advising it's still happening. Just less intermittent, but still annoying. Please fix. I think maybe I'll need to reload software, replace connectors, etc. I make sure I have what I need for my next visit. My next visit happens to be when the site is using the unit in the morning, and I ask to sit in to see if the issue comes up. Okay, no worries. Lucky for me, a clinical specialist for the unit is also there. I get some scrubs on and sit in the room with the PC, not in the theater. All the equipment is set up, multiple nurses, surgeon, patient on the table. About to start. Equipment testing is done, all good. I look at my unit in the theater, all good, connected correctly, plenty of slack. Then I see it. Not sure how anyone missed it. A nurse moves my unit to the side to stand next to the surgeon. The data cable that goes into the unit in the theater is connected, but it goes from the hole in the floor to the unit, and it's really taut and straining to be connected. And the connection to the unit is definitely iffy at best. There's no slack in the cable, and we give 3 to 5 meters so they can set up easily. They've just got a really weird setup of all the equipment, with my unit off to the side so that the cables almost don't reach at all. Surgeon asks nurse to connect a medical instrument to my unit, and this will need to be verified by the staff in the room I'm in that it's connected before they start. Instrument is connected, no verification. Medical procedure can't proceed. They try another instrument, same. Medical staff are checking connections, resetting software, surgeon is annoyed. I ask the clinical specialist that is in the room with me if this setup is usual for the procedure. Yes. I ask if we can move my unit a little closer, so that cable isn't straining so much. Clinical specialist says sure, walks in, moves the unit so the data cable has slack. I ask to have that cable reseated, and the connection reset. Clinical specialist says that's okay. It's also done. I need to ask because I'm a technical employee, and this is during a real medical procedure. I will not change anything without clinical personnel on my side giving the okay. Instrument is checked again for verification. Okay. Procedure can go ahead, surgeon is less annoyed. Nurse next to surgeon is a little annoyed that they have less space to work with. Procedure goes off without any issues. Clinical specialist and I check first instrument after the procedure is done to make sure it was good. It was also good. I advised of the issue and recommended personnel watch that cable. If it's not long enough, we can run another set of cables if need be. Or maybe just have the nurse stand on the other side of the surgeon. No issues since. Thank goodness. Things change after a buyout. This is a follow-up from taking over for bad IT. After working 8 great years with a medical manufacturing company, the news came in: we just got bought by big medical company, BMC. Oh, happy day. My stock options were worth money now. It will look great on the resume to work for BMC. The future looks bright. Or so I thought. Day 1, we all celebrate. Lunch is brought in and we do karaoke. Yes, I sang Billy Joel's Piano Man. Such great fun. Day 2, BMC has individual meetings scheduled. We are to bring our updated resume in order for them to consider reassignment, or so we were told. Instead, it was an end of employment meeting complete with documents showing us how to apply for unemployment and how to train for a new job. Our celebration quickly turned to sadness as we found out the manufacturing part of our product was heading to a facility in Juarez, Mexico. There would be no need for most other office jobs, HR, accounting, upper management, etc. I believe the only people they wanted to keep were our sales/consultants. When it came to IT, they have a standard policy to have no internal IT employees. All IT functions are hired out to third-party consultants. That hit me pretty hard. I went home dejected and not ready to find another job. I did determine to give the last 2 weeks the best I had to offer. Day 5, I'm called into one of the conference rooms with one of the BMC reps. Rep, hey Bam Bam 67, how are you holding up? Me, to be honest, I'm still in shock. We all worked so hard and I know getting bought was the goal, but how it all went down was a real disappointment. Rep, are you mad or upset? You can be honest. Me, I'm mostly sad. I worked really hard to make this place run like clockwork, and now I have a week left before I have to go find some other job. Rep, what if I asked you to stay on longer? Would you consider it? We need someone to take care of the salespeople and the servers you have on site. Me, I'd have to think about it. Rep, well, think about an extension of employment for another month. We'll meet again Monday. Well, what would you do? I'm at a point in my career that I'd never been paid higher. I know the servers inside and out and my users are quickly going to be cut, but my pay wouldn't. I would be in charge of the salespeople who are all remote. So I stayed. 1 month was extended to 3, 3 to 6 and 6 to 1 full year. It was bittersweet overall. I'd spend an entire week of every month getting the SOX, Sarbanes-Oxley, reports done, send out USB dongles to our salespeople, who would constantly lose or break them, and I would help our loan accounting person get things packed up and shipped out of the office. It was good work until it just became me and him only in the office during our last month. When I had to pack up my servers, I admit I shed a tear or two. We closed the doors to the office, and I separated myself from BMC. A month later, I get a call from the IT Temp Agency. They want me to help this other medical company because they just got bought by, yep, you know who, BMC. The pay was good, and they needed help swapping out their computers to the BMC computers, and I knew all the ins and outs. I took the job and met the 3 guys doing IT. They were all very nice and all positive about their future with BMC. I couldn't tell them awaited them day 1. They didn't know me or trust me. After working with them for 2 weeks and working long days replacing desktop after desktop, I was accepted into their group. I knew I was accepted when I was invited to attend a meeting with them and the VP of IT from BMC. VP was someone I had heard of and saw his name, but we never met or spoke. We go to the meeting and VP basically tells us that the deployment of desktops needs to move faster, and that an outside IT person was coming in to help. My new IT team looked at each other a bit confused, but if they needed to go faster, okay. And then, as the stars aligned, as we left the meeting, I take it upon myself to introduce myself to VP of IT. The quick conversation went like this. Me, Excuse me VP, I was the IT manager at, put my old company name here. We never got to meet each other, and I just appreciate the extra time you gave me so we could shut the office down. VP rudely, oh, you're the one. He sees my outstretched hand to shake, believe it or not, in the before time people actually shook hands as a sign of acknowledgement and respect, and just walks away. I could hear him mumbling. VP, talking to his other BMC PPL, that guy cost us a lot of our IT budget. I stood shocked at how incredibly rude a person could be. My blood started to boil. My new IT members, again I was just a temp, saw the entire interaction and were surprised. We all went back to our IT area and had a quick conversation. IT guys, Bam Bam 67, what was that with VP? Me, unfortunately, that is what you can expect from BMC. IT guys, what do you mean? Me, okay, I've only been here a couple weeks, you know I worked with BMC before after being bought out. Can I tell you what's really happening right now? IT guys, what do you think is happening? I'm happy to do this job for BMC. Me, you mean taking out every Dell computer that you deployed and switching them with a special BMC IBM? IT guys, yeah, sure, it's for security and standardization. Me, it's for them to take control of your network and your systems so they can remote into support. IT guys, but someone has to support the users on site, right? Me, yes, someone does. Who do you think is coming in to help with deployment? I believe the VP said he was a certified IBM support specialist. IT guys, so? Me, are any of you IBM certified? IT guys, no. Me, that guy coming in is going to replace you all, I have no doubt about it. And after working with you guys I couldn't stay silent any longer. Update your resume and start looking for a new job now. As soon as the computers are swapped out, they won't need you anymore. You are just overhead. A number on a report. You all saw how VP treated me after the meeting. I shouldn't have to say much more. We all found new jobs within a month by helping each other by reformatting our resumes, giving each other contact info, references, advice and more. The IBM support guy did take over all desktop support for the company. He would come in while I still worked my contract. All tickets that weren't emergencies were pointed to him. I was not allowed to help, just allowed to answer the phone. I would field calls asking when support was coming and all I could do is tell them to wait. Sometimes IBM support guy would come in late 9 to 10 a.m. if he came in at all. He would take an hour lunch and then leave by 2 p.m. After I left I kept in touch with people on the inside and was told he would take days to support the most simplest requests. When users are viewed as just users and not people, that's a big step towards bad IT support. When IT is viewed as just overhead, that plants the seed for creating bitter IT personnel, poor support, etc. BMC probably saves a ton of money by hiring third-party support, but they probably lose just as much in productivity from workers who have to wait or receive subpar support. Okay, I'm stepping down from my soapbox. I think I was there a total of 6 to 8 weeks before I found a new job as an IT director. I was excited about being hired at a beer distributor. What could go wrong? Sounds like fun, right? My time at Beer Distribute.